Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide brief remarks and then we'll open the floor to questions. I now turn it over to Dr. Hinshaw.
Thank you, Lisa, and good afternoon, everyone. I'd like to begin today with an update on this week's reporting and our media briefings, as well as a reminder about an upcoming change to the Restrictions Exemption Program. As the number of cases and hospitalizations continue to go down across the province, we are reducing the frequency of these media briefings. Starting today, COVID-19 media updates will be held once a week on Tuesdays. Numbers will continue to be posted online Monday through Friday and shared on my Twitter account as usual, and we will provide additional updates if any emerging issues arise. As such, this will be my only COVID-19 media briefing this week as we mark Remembrance Day on Thursday. Remembrance Day is, of course, an important time where Canadians come together to honour the service and sacrifice of those who served and continue to serve our country. To help organisers host safe Remembrance Day ceremonies this year, we have posted guidance online at alberta.ca. I'd also like to remind Albertans attending any ceremonies in person to be mindful of the physical distancing, masking, and capacity requirements in place to prevent the spread of COVID-19. And as always, if you have even minor symptoms, please stay home. Please also make sure to check ahead to see if the venue is participating in the Restrictions Exemptions program, and if so, make sure to have your proof of vaccination, privately paid for negative test or medical exemption handy. Speaking of the REP program, as we work together to stop the spread of COVID-19, I'd like to remind Albertans that beginning Monday, November 15th, Albertans' vaccine record must include the QR code in order to enter any business or venue taking part in the program. This means Alberta vaccination records without a QR code, including paper immunization records received at your vaccination appointment, will no longer be accepted. The exception to this is First Nations and military vaccination records, which will continue to be accepted. If you got your vaccine at an AHS clinic, a pharmacy, or a physician's office, in Alberta, getting your new QR code is quick and easy. You can visit alberta.ca/COVID records to get your QR code and either save it to your phone or download it and print it off. If you need assistance accessing or printing your record, you can visit a participating registry office where they will print it off for you for free, or you can call 811 to have your QR code mailed to you. If you were recently vaccinated, it may take up to 2 weeks for your online records to be updated with the latest dose. If it's been longer than that, and there is a dose missing or there are other issues with your record, please visit alberta.ca/COVID records help for assistance. Turning to today's numbers, I am pleased to report that we continue to see a decline in our overall case numbers. Over the last 24 hours, we identified 422 new cases of COVID-19 and completed about 8,300 tests. That puts our positivity rate at about 5.1%. This is a significant decline from the peak of our rolling 7-day average positivity on September 27th, when it was 11.3%. This decline in community cases is mirrored in the number of cases in schools. Currently, there are active alerts or outbreaks in 211 schools. Of these, only 10 schools had 10 or more COVID cases who attended within the last 14 days while infectious. The number of people in hospital for COVID-19 also continues to decrease. Currently, there are 608 people being treated for COVID-19 in hospital, 128 of whom are in the ICU. While we are headed in the right direction, I want to be clear that this is still a significant number of people in hospital, taxing our healthcare system. We must all continue to support efforts to bring these numbers down even further. And sadly, despite our declining case numbers, Albertans continue to die from this virus. In the last 24 hours, 8 new deaths were reported to Alberta Health. Following a review, as per our usual process, 4 previously reported deaths have been reclassified as non-COVID. As a result, the total deaths will increase today by 4. My condolences go to the family and friends of individuals who are mourning a loss, whether it's from COVID or any other cause. Every life matters. As we have seen from our daily numbers, the single best defense we have against COVID-19 is vaccination. Not only does it help to prevent asymptomatic and symptomatic infection, it also greatly reduces the risk of serious illness, hospitalization, and even death. In Alberta, the odds of being hospitalized with COVID-19 are approximately 8 times higher if you're only partially vaccinated and 10 times higher if you're unvaccinated. I continue to urge every eligible Albertan to get fully vaccinated as soon as possible, no matter your age or health status. In addition to vaccines, we now have an additional tool to help prevent severe outcomes for those at the highest risk. Alberta Health Services has begun administering a new monoclonal antibody treatment for COVID-19 that was recently approved by Health Canada. Sotrovimab is a new drug that was developed specifically for treating patients with COVID-19 who have mild to moderate COVID-19 symptoms. It is the first treatment to be offered to outpatients in Alberta. For maximum effectiveness, it must be administered within 5 days from when the symptoms begin. But let me stress that sotrovimab is not a replacement for COVID-19 vaccines. Albertans are still strongly encouraged to be vaccinated against the virus, as vaccines are the most effective method to prevent the serious outcomes from the disease. Today, AHS's EMS mobile integrated health teams began administering sotrovimab to patients in their homes who are age 65 and older, are positive for COVID-19, unvaccinated, and who wish to have this treatment offered. Patients in Fort McMurray and surrounding areas will receive treatment in an AHS clinic. Some patients who have received a solid organ or stem cell transplant will also be eligible to receive this treatment regardless of their vaccination status. The treatment is being rolled out across the province in a phased approach, starting with those at the highest risk of severe outcomes like hospitalization. For more information on this program, please visit ahs.ca/COVIDopt. While this medication is helpful, it does not change the fact that vaccines continue to be our most important tool to protect both ourselves and others. Vaccines are safe and effective for everyone, including those who are pregnant, planning to become pregnant, or those who have recently given birth. I know I have spoken of this topic often, but misinformation continues to circulate, particularly a rumor that COVID vaccines may be causing miscarriages. I want to assure Albertans that we continue to look at safety, including this particular question in detail. There is no evidence that miscarriages or stillbirths have increased after COVID-19 vaccines have been made available. In fact, evidence shows there has been a slight but steady reduction in the number of miscarriages in Alberta starting in 2019, prior to the COVID pandemic, and this has continued over the following 2 years. It is important to note that getting fully vaccinated can help protect pregnant Albertans from severe outcomes from the virus. COVID-19 infection in pregnancy is a risk to both parent and child. It's critical that pregnant Albertans be vaccinated not just for themselves, but also for their babies. We take vaccine safety extremely seriously and continually monitor information on adverse reactions not just in Alberta, but around the world to be able to ensure that our vaccine programs are safe and effective. For anyone hesitant about getting vaccinated, I urge you to seek out trusted expert sources to help you make an informed decision. Booking an appointment is easier than ever, with many pharmacies across the province accepting walk-ins for COVID-19 vaccines. Or you can book an appointment time that works best for you through the Alberta vaccine booking system online. If you are part of a group that is eligible for a booster dose, I encourage you to sign up for that additional dose once the appropriate amount of time has passed from your second vaccine. For more information on eligibility, please visit alberta.ca/vaccines. The encouraging trend of falling case numbers and declining hospitalizations is the direct result of more Albertans getting vaccinated and following the public health measures that are currently in place. But as we've seen here and in other jurisdictions across Canada and around the world, these trends can change quickly if we are not careful. That's why we must remain vigilant about following the rules and making choices that help prevent viral spread. Please continue to do your part. Follow the measures in place, wear a mask, and stay home if you're feeling unwell. Together, all of our individual efforts will help us get through this fourth wave and help thousands of Albertans get the surgeries and procedures that they have been waiting for. Thank you, and I'm happy to take questions.
As we have no reporters in the room, we will now take questions from the phone. Please limit yourself to one question and one follow-up. Operator, could you please put through today's first caller?
Thank you. Carly Robinson, City News.
Hi, Dr. Hinshaw, just looking to get some reaction to Health Canada approval for booster shots and when you think they might be best suited for general public in Alberta.
So the announcement that Health Canada has approved Pfizer vaccine for a third dose is encouraging. We have been working with the National Advisory Committee and our own Alberta Advisory Committee as we've been watching data over the past several months to focus on those who are at highest risk of severe outcomes if they should have a breakthrough infection. And so we have been recommending the use of this vaccine in anticipation of this particular change, but also knowing that we believe that the risks of severe outcomes from breakthrough COVID infection in those high-risk populations outweighed any risks of waiting for this particular decision to be made now that this authorization has happened. It's encouraging, but it also doesn't change the need for that ongoing assessment of the epidemiology of the disease, who is most at risk from severe outcomes after breakthrough infection. And so we'll continue to work with the National Advisory Committee and our own Alberta Advisory Committee on Immunization regarding their recommendations with respect to boosters for the general population. We know from our data that vaccines continue to provide very strong protection against severe outcomes for the general population. And those groups that are currently eligible are those who may have an increased risk, which again is why they're now able to receive that third dose. So I think there's no specific timeline with respect to decisions. Again, we continue to monitor the evidence and make recommendations based on best available evidence.
Carly, did you have a follow-up?
Yeah, I'm just wondering if you could give us an overview of how the booster program has been going. Do we have numbers of how many people have signed up and so on and so forth?
I don't have the specific numbers at my fingertips. I know that the groups that were announced as eligible at the beginning of the booster program, so a few months ago when we moved to make third doses available to those who live in continuing care facilities, followed by those who are immune compromised, as well as those who are 75 and older. We can provide some data offline to you. I don't have those numbers at my fingertips, but we know that we've been able to offer that third dose to everyone who lives in continuing care. So everyone's had that opportunity to take advantage of a third dose. And we know that groups that were eligible sooner have higher uptake just because they've had longer to be able to take advantage of that third dose. And again, we can follow up offline with the specific numbers.
Operator, could you please put through the next caller?
Kevin Nimick, CTV.
Hi, Dr. Hinshaw. Have you expressed concerns to either Alberta Education, the Education Minister, or any school boards directly regarding the quality of ventilation systems in school?
When we worked on our guidance for schools with respect to public health advice, improving ventilation is one of a list of things that we recommend that schools look at, making sure that ventilation is following the appropriate standards for heating, ventilation, and air conditioning. it's important to remember that whenever changes are made to indoor air quality, they should be made under the guidance of a professional in that area, because indoor air quality is not just about infectious disease, it's about other aspects in terms of the numbers of air exchanges, other aspects that any change in one part of an air filtration system or ventilation system can impact other parts of it. So again, it has been a part of our guidance for schools. It's a part of the list of things we recommend. And again, any changes or any upgrades really need to be done with the advice and under the supervision of experts in that field.
Kevin, did you have a follow-up?
Sure do. Can you provide an update on vaccines for children in Alberta? What have you done specifically to prepare for the rollout for children under 12?
We're making sure that planning is in place, so planning is in place to be able to have clinics and locations so that at the moment of a decision by Health Canada, if Health Canada approves, once it goes through the very strict regulatory process that is necessary to ensure that the appropriate steps have been taken to assess the evidence on pediatric vaccine, that if Health Canada makes that decision and licenses pediatric vaccine, that Albertans would have access to it in a quick way. But of course, it is critical that the process be followed because we take vaccine safety very seriously, especially for children. So it's really important to be able to give Health Canada the time it needs to go through the submission and go through all of the processes that they typically do to make sure that the vaccine can be assessed before a final decision is made. And then pending that decision, again, if they approve it, we will be ready to go to offer it to Albertans.
Operator, could you please put through the next question?
Sarah Comadina, Global News.
Hi, thank you for taking my question. I wanted to ask about the Western strain that we have been hearing about. I'm wondering how concerned you are about this, and if this is actually a Western variant, or is it something similar to the Delta variant?
It's interesting how this particular conversation has evolved, because what's being termed in some circles as this Western strain is actually a sublineage of the Delta variant. So it is not a different variant of concern. There's no evidence that it causes any more severe illness, that it evades vaccine protection, that it's significantly different from the Delta variant that has been circulating as the dominant strain in Alberta since late summer. So we know that when viruses replicate, they can change their genetics slightly, and so sometimes you have these sublineages that evolve, but that doesn't necessarily mean that they behave differently from that parent strain, and that's the case with this particular sublineage. So it really is behaving very similarly to Delta and isn't considered to be significantly different from, again, that Delta variant that's been dominant here for several months.
Sarah, did you have a follow-up?
Yeah, I did want to ask too, you mentioned that the vaccines, we have been seeing a vaccine uptake, and that has been contributing to seeing lower case numbers. I'm wondering with our vaccine status, if we are seeing people that were hesitant prior now taking an opportunity for the vaccine.
Since we move forward with the additional encouragement, again, that kind of structural encouragement of the restriction exemption program, we have seen a number of Albertans who previously didn't have first or second doses step forward to take advantage of the protection that vaccine offers, not just for them, but for those around them. Again, the specific numbers of how many Albertans have stepped forward to take first and second doses in the last couple of months we could provide offline. But we have seen an increase over the last couple of months. And of course, as our vaccine coverage increases, that helps with protection for those individuals and for the people they interact with.
We have time for 2 more questions. Operator, could you put through the next question?
Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Thanks for taking my question this afternoon. Of course, it is good news that we are seeing numbers trending downward, but in the last week and a bit, kids 5 to 11 have started to see an increase in case numbers again, faster and continuing to be higher than any other age group. Can you speak more to that, your concerns, possible causes of the driving force behind this increase, and how to specifically bring down cases for kids in those age groups who can't have vaccine protection?
We know that that particular group of kids, as you mentioned, is not yet eligible for vaccines. Thankfully, we also know that that particular group is at the lowest risk of severe outcomes, although, of course, they can transmit onward to others. We have seen a dramatic decline in that age group since the peak in late September. So the age-specific rates, while they are higher than other age groups, they are much lower than they were just 6 weeks ago. The critical piece, and of course we are watching Health Canada's decisions closely, but at this particular time, while that particular age group is not eligible for vaccine, the same kinds of things that we know we can do to protect those around us who may be older and vulnerable, we can also do to protect those who are younger. So making sure that everything possible is being done for the individuals who are eligible for vaccine to be fully vaccinated. So adults and older children who regularly interact with those younger kids, taking that protection opportunity of vaccine, as well as making sure that all of us collectively are doing our part to stay home if we're feeling a little bit sick, getting tested. We do, of course, at this time have the notification program running in schools. So if there is an exposure where someone is infectious while in a school, that individuals who may have been exposed are notified, adding that additional layer of protection, ensuring that masks are worn consistently, especially when indoors. So all of those layers of protection are important. Because any one of them by itself will not be sufficient, but making sure that we have as many of them as possible in place helps, again, not just for that particular age group, but all those who are around them as well.
Lauren, did you have a follow-up?
I do, thank you. Dr. Hinshaw, just a clarification, though. We have seen an increase in that age group in the last week or so, so I'm hoping you can speak to that. And then my follow-up question is about Health Canada saying that the review for 5 to 11-year-olds could be complete as early as the middle of November for the Pfizer vaccine, rather. Have you had any conversations or heads up from a federal level or Health Canada, and any information on that survey to parents in Alberta about COVID kids vaccination? So first, just that clarification on my first question, however. Thanks.
Sure. So the last week, as you say, the steady decline that we've been seeing over the previous time frame hasn't been as steep. I would say that there's been, again, that little bit of a shift, perhaps a bit of a plateau, a bit of an upturn. It's not clear exactly what's causing that, but we do know that with cold weather approaching, with more activities happening indoors, that there is, for all age groups, that additional increase in potential transmission if we spend time indoors with people who aren't in our same household. And so, again, making sure that all of us collectively are staying home. Those of us who have young children in that age group, making sure that if our kids are feeling a little bit under the weather, that they stay home from their extracurricular activities, they stay home from school. Those are the kinds of things that we all collectively need to do. With respect to the pediatric vaccine, we're in regular communication with Health Canada and our federal partners to understand roughly where they're at. Of course, their internal deliberations are confidential, and so we will find out when they have made their final deliberations and determinations. They will provide us a heads up, but of course their process, again, has to go through all of the typical steps, and so they're really not able to tell us a precise day, but we are in regular communication with them. And as I mentioned earlier, certainly if they reach that decision to approve the vaccine, then we will be ready to go to offer it to Albertans.
Operator, please put through our final question.
Hamdi Isawi, Post Media.
Hi, Dr. Hinshaw. At a press conference this morning, Premier Kenney said the province had asked AHS to exercise common sense and ensure that the vaccine mandate for healthcare workers doesn't impact the capacity of the system. He specifically referenced smaller and rural hospitals and healthcare centers where a significant number of staff aren't complying. Is AHS being asked to exercise some kind of leniency or exception in these cases, and if so, what will it look like?
I wouldn't be able to speak to the decisions that AHS is making as an employer. Of course, in Alberta, vaccine requirements have been left to, or that opportunity is being taken by employers to determine what requirements they feel are appropriate in their workplaces. Certainly in healthcare settings where people who work in those settings are caring for individuals who are at high risk of severe outcomes should transmission events take place. Being vaccinated is an incredibly important part of ensuring a safe environment for healthcare, but decisions about exactly how that plays out, again, are something that Alberta Health Services would be better able to comment on.
Hamdi, did you have a follow-up?
If you're able to answer, are you aware of any efforts being taken to encourage vaccine uptake among healthcare workers in rural settings before the November 30th deadline?
I wouldn't have the details on what AHS may be doing specifically, but certainly in terms of work being done in government to encourage everyone across the province, whether rural or urban, to take advantage of the protection that vaccine offers. We have been working to partner with local leaders in different areas to be able to deliver that message of how important vaccines are, not just for the people who receive them, but for those around them, as well as ensuring that there is easy access available, whether that's through pharmacies, whether that's through mobile vaccination clinics. So some of that kind of infrastructure, the communications work that's underway, are ways that, again, I've been involved in making sure that we are doing everything we can to make sure that people have the information they need, as well as easy access to vaccines. And then, of course, Alberta Health Services would be able to speak specifically about anything that they may be doing for healthcare workers in particular areas.
That concludes today's availability. Thank you for joining us, and have a good evening.